Which area must be ISO Class 5 when preparing sterile radiopharmaceutical syringes? A. Ante-area. B. Buffer/clean room, PC/SEC. C. General pharmacy area. D. Storage room. Answer B. Sterile preparation requires an ISO Class 5 work zone, PC or SEC, where the critical site, syringe tip, vial septum, is exposed. Ante-areas and general pharmacy areas have higher ISO counts. The primary reason for using a laminar airflow workbench, LAFW, is to A. Maintain negative pressure for hazardous drugs. B. Provide unidirectional HEPA-filtered air over the workspace. C. Heat solutions to speed dissolution. D. Store compounding supplies sterilely. Answer B. LAFWs supply unidirectional HEPA-filtered air to sweep particulates away from the critical area, protecting the sterile field. They are not for heating or storage. Which garbying item is applied last before entering the ISO Class 5 primary engineering control? A. Shoe covers. B. Face mask. C. Sterile gloves. D. Hair cover. Answer C. Gloves are donned last and must be sanitized/gloved sterilely right before handling sterile components inside the ISO Class 5 PC to maintain asepsis. For low-risk compounded sterile preparations, CSPs, stored at room temperature, USP less than 797 generally allows a beyond use date, BUD, of A. 24 hours. B. 48 hours. C. 14 days. D. 30 days. Answer A. Low-risk CSPs stored at room temperature typically have a BUD of up to 48 hours in older guidance, but current conservative practice often uses 24 hours for certain settings. For exam purposes, the short BUD reflects microbial risk at room temp. Always follow current institutional policy and USP standards. Which of the following is a critical site during vial preparation? A. The outer label. B. The vial septum after disinfection. C. The plunger end of a syringe before assembly. D. The bench top outside the ISO Class 5 area. Answer B. The vial septum, after proper disinfection, is a critical site because it is accessed and must remain sterile while drawing medication. When reconstituting a powdered sterile drug, the diluent should be A. Only sterile water for injection unless specified otherwise. B. Any sterile fluid available. C. A non-sterile diluent if heated. D. Normal saline only. Answer A. Reconstitution requires the diluent specified by manufacturer, often sterile water for injection or bacteriostatic water. Using unspecified diluents can alter stability or safety. Which cleaning agent is commonly used for daily cleaning of ISO Class 5 work surfaces before compounding? A. Non-sterile detergent only. B. 70% isopropyl alcohol after detergent cleaning. C. Plain water. D. Household bleach only. Answer B. Surfaces are typically cleaned with an appropriate detergent then disinfected with 70% isopropyl alcohol to remove residues and disinfect the area prior to compounding. In compounding, the term aseptic technique refers to A. Procedures to limit microbial contamination during sterile preparation. B. Using sterile gloves only. C. Cleaning surfaces with soap. D. Labeling medication syringes correctly. Answer A. Aseptic technique encompasses all practices, garbying, disinfection, sterile transfer, that minimize contamination of sterile products. Which organization issues standards like USP less than 797 and USP less than 800? A. FDA. B. State boards of pharmacy only. C. United States Pharmacopoeia, USP. D. CDC. Answer: C. USP publishes enforceable compounding standards such as less than 797, sterile compounding, and less than 800, hazardous drug handling. Enforcement often comes from state boards or accrediting bodies. When compounding hazardous sterile drugs, which pressure condition should the buffer area maintain relative to adjacent areas? A. Positive pressure. B. Neutral pressure. C. Negative pressure. D. Fluctuating pressure. Answer: C. For hazardous drug compounding, negative pressure containment prevents airborne hazardous particles from escaping to adjacent areas, protecting personnel and other medications. What is the main hazard addressed by USP less than 800? A. Microbial contamination of CSPs. B. Handling and compounding of hazardous drugs to protect personnel and environment. C. Controlled substance inventory. D. Billing and reimbursement for compounding. Answer: B. USP less than 800 focuses on safe handling of hazardous drugs including engineering controls, PP, and containment to reduce occupational exposure. Which of these is not acceptable for sterilizing small volumes of non-heat stable drugs? A. Filtration through a 0.22 m filter. B. Using single-use sterile syringes for transfer. C. Purchasing them as commercially sterile products. D. Autoclaving at high temperature. Answer: D. Autoclaving subjects drugs to heat and steam that can degrade non-heat stable drugs. Filtration and purchasing sterile preparations are appropriate alternatives. While performing sterile compounding, the RPH asks the technician to recap a used needle. What is the correct response? A. Recap using a two-hand technique immediately. B. Refuse and follow no recapping policy, use a sharps container instead. C. Recap with the hand over the needle. D. Recap and store for later use. Answer: B. Used needles should not be recapped by hand to avoid needle sticks. They should be disposed of immediately into an approved sharps container as per safety policy. Which piece of PP is most important to prevent contamination from respiratory droplets? A. Shoe covers. B. Beard cover/mask. C. Sterile gown. D. Face mask covering nose and mouth. Answer: D. Face masks reduce droplet contamination from the mouth and nose. For compounding, masks are essential to prevent microbial contamination of sterile products. A laminar flow hood provides protection to the product. Which group also requires protection from exposure when compounding hazardous drugs? A. The product alone. B. The environment and personnel. C. Only the patient receiving the drug. D. Only the pharmacist on duty. Answer: B. Hazardous drug compounding requires protecting the product, sterility, and also protecting personnel and the environment from drug exposure via containment and PPE. Which compound would require use of a Class II Biological Safety Cabinet (BSC) rather than a standard LAFW? A. Non-hazardous 4-antibiotic. B. Sterile saline admixture. C. Hazardous cytotoxic chemotherapy. D. Reconstituted vaccine. Answer: C. Hazardous drugs, e.g., cytotoxic chemo, require containment provided by Class II BSCs for personnel and product protection, rather than standard LAFWs that do not provide containment. When calculating final concentration, which formula is used to find percent strength, with V? A. Weight of solute/volume of solution, times 100. B. Volume of solute/weight of solution, times 100. C. Volume of solvent/volume of solution, times 100. D. Weight of solute times volume/100. Answer A. Percent weight/volume is grams of solute per 100 milliliters of solution. The formula, G solute/ml solution, times 100 gives percent, with V. An RBT needs to compound 250 milliliters of a 0.9% sodium chloride solution. How many grams of NaCl are required? A. 0.9 g. B. 0.225 g. C. 22.5 g. D. 2.25 g. Answer D. 0.9% with V equals 0.9 g per 100 milliliters. For 250 milliliters, 0.9 g/100 ml times 250 milliliters equals 2.25 g NaCl. Which documentation is essential after compounding a sterile preparation? A. Patient allergy list only. B. Compounding record with lot numbers, BUD, personnel initials, and calculations. C. Only initial prescription and nothing else. D. Manufacturer marketing literature. Answer B. A complete compounding record documents formulation, lot numbers, expiration/BUD, personnel, weights/volumes and calculations to ensure traceability and quality control. Which step reduces particulate contamination when withdrawing fluid from a vial? A. Shaking the vial vigorously before puncture. B. Using a non-sterile syringe. C. Recapping the vial after each withdrawal without disinfecting. D. Wiping the septum with an alcohol swab and allowing it to dry. Answer D. Disinfecting the septum and allowing it to dry reduces surface microorganisms, shaking increases particulates and is not recommended. For non-sterile compounding, which dosage form must be prepared in a dedicated area to prevent cross-contamination? A. Chewable tablets manufactured in unit dose. B. Topical creams containing potent hormones or cytotoxics. C. Simple syrup for pediatric use. D. Chewable vitamins. Answer B. Potent or hazardous topical compounds require segregation and dedicated equipment to avoid cross-contamination with routine non-hazardous preparations. Which calculation finds the volume needed when diluting a concentrated solution? A. C1 times V1 equals C2 times V2. B. C1 plus C2, / V1 plus V2. C. V1 times V2, / C1 times C2. D. C1 minus C2 equals V1 minus V2. Answer A. The dilution equation C1V1 equals C2V2 is used to calculate the volume of stock solution, V1, needed to achieve desired concentration, C2, and final volume, V2. If a vial label states sterile unless opened, what is the appropriate BUD after compounding and storing refrigerated? A. Manufacturer's indicated BUD only, always 6 months. B. Follow institutional policy and USP guidance for open vials, do not assume indefinite sterility. C. No need to document BUD. D. Assume indefinite sterility if refrigerated. Answer B. After opening, vial sterility depends on handling and storage. BUD must follow USP/institutional guidance, not indefinite. Proper documentation is essential. Gloved fingertip sampling is a form of A. Environmental air monitoring. B. Personnel competency testing for aseptic technique. C. Surface cleaning only. D. Product sterility testing for every batch. Answer B. Gloved fingertip/thumb sampling assesses personnel aseptic technique and glove integrity as part of competency and qualification procedures. Which of the following cleaning schedules is appropriate for ISO Class 5 surfaces prior to each batch? A. Once monthly. B. After every shift only. C. Before each compounding session and periodically during extended compounding. D. Never, only disinfect once a year. Answer, C. ISO Class 5 surfaces should be cleaned and disinfected before each compounding session and at intervals for prolonged compounding to maintain aseptic conditions. A compounded non-sterile ointment requires USP-grade components. The main reason is A. Lower cost. B. Higher purity and traceable quality for patient safety. C. They dissolve better in water. D. They are easier to order. Answer, B. USP-grade ingredients meet standards for purity and quality, reducing the risk of contaminants and ensuring predictable performance in compounded products. What is the correct action if a sterile product shows visible particles after compounding? A. Filter and give to patient. B. Return to stock and relabel. C. Quarantine and investigate, do not release for use. D. Shake vigorously to disperse particles. Answer, C. Visible particulates indicate contamination. The product should be quarantined, investigated for root cause, and not dispensed. When gravimetric measuring is used in compounding, the technician measures A. Volume only. B. Mass/weight to improve accuracy over volume measures. C. Color changes only. D. pH of a solution. Answer, B. Gravimetric dispensing uses weight, grams, to ensure precise measurement of ingredients, often more accurate than volume measurements for powders and viscous liquids. Which item is used to ensure laminar flow is not obstructed in a LAFW? A. Placing supplies directly in front of the air supply area blocking flow. B. Placing the largest items at the front edge. C. Working with the hood doors closed entirely. D. Minimizing equipment in the primary work area and placing items systematically to avoid disrupting unidirectional airflow. Answer, D. To preserve unidirectional airflow, items should be kept minimal and arranged to avoid blocking the HEPA airflow over the critical area. For hazardous drug compounding, which PP is specifically required beyond standard sterile garb? A. Steel-toe shoes. B. Double chemotherapy-rated gloves and impermeable gowns. C. Sandals to prevent slips. D. No mask required. Answer, B. Handling hazardous drugs requires specialized PP such as chemotherapy-rated gloves and impermeable gowns to reduce skin exposure. Other PP like appropriate respirators may also be needed.